All right, good morning, everybody. Great to see you all. Thanks for those folks who are returning and new folks. Today will be a new webinar. We'll be talking about the urban-rural divide as it relates to COVID. So there's some pretty interesting and important differences between COVID in urban and rural communities that we wanted to talk through today. So a little bit of housekeeping before we get started. For those of you that are new, this is a one-way only webinar, so you can hear me. So the best way to do questions, and we'll pause throughout the slides a couple of different times, is through the chat and the questions tab. So as we're going through the content, if anything pops up or you want to ask any clarifications or anything else, feel free to go ahead and enter that in the chat and questions tab, and we'll come back to those. This is one of a series. I think we're up to 5 or 6 that we've done now around COVID and community impact. So always love feedback. If there's other topics or areas that you'd like us to cover, please feel free to let us know. So last piece of housekeeping, you will get an email right at the end of this with a link to the recording, and then we'll send out an update at the end of the webinar with the slides as well as a YouTube link that you can share around with the recording for anybody else that might find it useful. All right, so a quick introduction. My name is Mike Reich. I'm with DataContours. We are a data and analytics firm specializing in community and population health data, as well as local COVID impact forecasting. We've been doing this work for about 10 years. We've got a lot of experience working with county and local health departments, as well as health systems doing needs assessments and strategic planning. And our passion is bringing data to decision making and strategy. So we've built a set of tools and modeling capabilities that help folks do that. So today we're going to try and answer 4 different questions, and this has come up a lot. And I think especially as we get into the fall, there's some pretty significant things to consider depending on whether you're in an urban community or a rural community as to how you frame response and planning for COVID impacts. So we want to talk about what some of those differences are. What are some of the factors that mean that the COVID impacts have been felt differently? We'll talk about sort of what data can be helpful for understanding the impacts, some implications on equity, and how communities respond and how resilient they are, and then some recommendations and some thinking about how, specifically with rural communities, we want to be thinking about response differently than we are with urban communities. Okay, so how are urban and rural communities different? We'll start off talking about urban communities. I think so far, what we've seen over the last 3 or 4 months is both in coverage as well as in research, as well as in just case counts, period, have been really focused on urban communities. So the major sort of factor with COVID and how it spreads is population density. And so obviously communities that are more dense are going to see a higher rate of infection, which means it spreads more quickly, and the number of infected people at the same time gets a lot larger. So initially in March and April, we saw that in the New York area. Now we're beginning to see it in southern and western states, but it's largely, those outbreaks are largely focused on urban communities. So Houston and Phoenix and LA and Miami, for example. And the numbers in those urban communities will obviously always be a lot larger than they are in rural communities. But there are some important distinctions to draw out there. So as we get through this and as we get into the fall, we would expect to see continuing sort of outbreaks in urban communities, certainly, and that'll be the majority. Within those urban communities, one of the important aspects that we see, especially now as economies have kind of reopened and a lot of the initial shutdown response is no longer in effect, is urban outbreaks are really represented by this community spread, and that would be so greater than 40% of infections are unidentifiable sources. So it's somewhere in the community, a door handle or a restaurant, but contact tracing within these communities, these urban communities, is a lot more difficult because it is uncontrolled community spread. And the other thing that we see within urban communities, because the infections are so significant, is the hospital capacity is obviously a huge focus. One of the interesting dynamics, though, that we'll talk about is urban communities generally have a wealthier, younger population. And so a lot of the dynamics that vary from place to place or from urban and rural are really due to some of these population dynamics that we see. So health system capacity and hospital capacity, and in particular ICU utilization, is lower than expected in a lot of these urban centers because the population is less at risk. It's younger, it's healthier in a lot of different ways. But we still see the response focus on handling these large, relatively discrete surges of need within health systems. And this reflects that we're likely to see higher peaks of infection with this unmanaged exponential growth, but that within a particular urban community, the larger the peak, the more quickly we get over the peak. More people are infected all at one time, and so we reach some amount of, I won't say herd immunity, but some amount of folks at high risk who have already been infected, so they're not likely to get infected again, at least within the next 6 to 12 months. So we can compare and contrast this with rural communities. So about 48 million people in the United States are in rural areas. And so far, the outbreaks within rural areas have been characterized by sort of sporadic workplace events rather than the general levels of community spread that we see in urban communities. So the inverse of this is that most of the infections within rural communities are traceable back to a particular point of infection. And there's usually a cluster of people who were all at the same place at the same time who became infected coincidentally. And there's a lot of implications that we'll come back to with this dynamic. So lower total population, but ultimately the population in rural areas is at a much higher risk for severe effects. So there's a couple of dynamics that are going to come into play. So why are rural communities at higher risk? So for most of you, this is probably going to be pretty familiar. This is well-known data that rural communities and rural populations are at higher risk because they're older. Typically, there's a higher poverty rate in rural communities, higher rate of comorbidities like obesity, high blood pressure, heart disease, which are directly correlated with anywhere from 2 to 10 times more risk and worse outcomes with COVID. So you combine that with the older age, these are populations that are much more vulnerable to the significant impacts, the long-term hospitalization, requiring ventilators than generally communities in urban areas. And then you marry that with this long-term trend in reduction in healthcare and hospital capacity in urban or in rural communities. And there's kind of a worst case scenario where the people who need the most care are also the ones that are most farthest away from hospitals, and the hospitals that they are close to tend to be much smaller with much fewer resources and expertise. in these for these folks who require intensive care. And then the last piece, which is an interesting dynamic, is rural communities generally have less ability to practice social distancing as compared to their urban counterparts. And when you think about this, rural communities typically are much farther apart, so they're less dense. If you are talking about isolation, they have less ability and less access to services like food delivery, where folks in urban centers are able to, not go to the grocery store because they can have food delivered. People in rural communities really don't have a lot of those options, and so mixed with high poverty rate, most folks in rural communities have to work. And so there's less ability for people just to stay home for a long period of time. The industries they're in are less amenable to things like work from home or work remote policies. So there's a whole bunch of factors that limit the effectiveness of social distancing because people aren't just functionally able to adhere to it. So as we think about where the vulnerable populations, this actually looks kind of different as well. In the industries in particular, where we've seen high rates of infection within urban communities, tends to be focused on hospitality service sector workers. So high rates of infection among house cleaners, folks who are interacting with living environments, et cetera. And then also healthcare workers, obviously. So they are probably obviously the most vulnerable and the most susceptible and present around areas of infection. When you compare that to rural communities, what we're seeing is seasonal and agricultural workers, and then migrant and undocumented communities tend to be the places where we see the highest vulnerability to infection. And some of this is due to just the nature of the work. With seasonal agricultural workers, they are in facilities like packing facilities or meat processing plants that are just very conducive to the spread of the virus because they're close quarters, they're working long hours, relatively, recirculated air that's relatively high humidity. And conversely, these also tend to be the communities that are least likely to seek out care, that are very wary, obviously, of government intervention, and also from an economic standpoint are least able to forego work or to adhere to social distancing practices. So when we think about targeting interventions and looking at different populations, I think it's important to recognize that those populations are going to be different, whether you're looking at an urban community or looking at a rural community. And then one of the things that's also emerging, and if you saw the last couple of webinars we've done, we focused a lot on the economic impacts and what we're likely to see. And unfortunately, we're now a week beyond the expiration of a number of different programs that were supporting folks economically. Rural communities are a lot more susceptible to negative economic impacts than urban communities, mostly because they have a lower income, average income, higher rate of poverty, and so generally less affluent than urban communities. But you also mix, again, lower access to services, fewer resources, there's a whole number of economic factors which increase the impact as compared to their rural counterparts. One interesting dynamic, though, is the immediate economic impact that we've seen over the last couple of months has actually been lower in rural communities because the industries that have been hardest hit by the shutdown and by the economic impacts of COVID, those have been largely centered in urban and semi-urban areas. So agriculture we really haven't seen a significant, at least from the national numbers, significant impact yet in consumption. Though we would expect that the longer this goes on and sort of the farther out the ripples go from the economic impact, the more likely it is that we'll see significant challenges in rural communities. And the one interesting area of this has been rural communities that are not agriculture dependent, but rather are tourism dependent, have absolutely seen immediate impacts and will continue to see long-term impacts. Tourism and travel is one of the likely one of the industries that is looking at multiple years of significant depressed activity, and there's pretty significant implications, especially for rural gateway communities to national parks or forest land or recreation areas where significant 70–80% of their economy is dependent on tourism. So you combine that with limited access to social safety net services, services and community-based organizations, which are typically smaller and farther apart in rural areas for supplying food, for example. So there's potentially, this picture that's emerging of longer-term economic effects that are much more significant in rural communities and end up exacerbating these trends that we've seen going on. So increase in poverty rate over the long term, the last 30 years, decrease in wages, increase in average age, that's likely to accelerate and get worse over the next 5 to 10 years based on the impacts that we've seen over the last 3 months. So the high level takeaway as we think about the urban-rural divide, fundamentally, is that rural communities are more likely to face severe COVID impacts for longer than urban communities. They're less resilient, they're less able to recover quickly, and because of the population characteristics, the impacts that they'll feel will be proportionately greater. So let me pause there. Happy to answer any questions on that last section. And again, feel free, if you have any questions, feel free to type in the chat over the questions tab on the sidebar there. Okay, let's go on to the next section. So what are the response challenges? In particular, we're going to focus on rural communities. Again, I think much of the attention, research, and media coverage has been focused on the response in urban communities. And so there's some things that we feel like are worth highlighting about those challenges and how they're unique within rural communities. So the first thing that we see is the shape of the disease is different. And what do I mean by shape? If you think about looking at a long-term chart of or graph of active infections, we see a very different pattern in urban areas than we see in rural areas. So the chart on the left is kind of the prototypical infection, active infection graph for an urban area, which has a very large spike and then a fairly rapid decrease and then a plateau. And this is what we saw in New York. This is what we're beginning to see emerge on the backside of Miami, of Houston. And the reason this happens is because the rate of infection, that exponential growth within a highly dense urban area, is so big that most of the people who are likely to be infected are infected kind of in one go. And this is the surge that we talk about with hospital capacity. And we also see this with infections and with deaths. So pretty consistent. And certainly, one of the things we're discovering is there may be multiple surges, but they're really separated by months, long periods of time. And it's typically where we'll see one sector of the population infected initially, and then another sector of the population infected, both of those characterized by large-scale community spread. So again, over the last 4 months, early on in New York and New England, the initial infection was really focused on folks over the age of 60, which is what led to the mortality rate being so high in those communities. Now, in some of these other urban areas, we're seeing it really focused on young people. However, it's beginning to expand into these older populations. So when we look at rural areas, and now there's been a lot of really good evidence from rural counties showing that we see a very different pattern. We see what we call the spikes. And so these are smaller but more frequent outbreaks that occur because of workplace infection or social contact through religious services, for example. But they happen at a lower level. We're talking hundreds of people rather than hundreds of thousands. Proportionally within the community, it's a large percentage, but in absolute terms, it's not as big. But the key thing is it happens more frequently because there's not the large scale community spread, because the population density is lower in these urban or rural areas. They are actually more susceptible to these more frequent outbreaks. Because different communities, different groups of folks, different workplaces, you can have one infection that leads to 200 very quickly. So it's a different challenge for a lot of different reasons. That differing shape of the disease leads to what we call the surge versus the spike or spikes. In thinking about spikes within rural communities, again, the smaller outbreaks more frequently are going to have a larger impact on rural communities than the equivalent surge does in a large community, both because it's more consistent over time, but also it's a large portion of the population. And one of the concerns is that rural communities are going to see or are likely to see these spikes for longer than urban communities are going to see the surge. So you have an early surge within an urban community, you start to go down, like we've seen in New York, where they've been below 1% positive infections for about 2 months now. So they're on the backside of it on the plateau. Likelihood is they're not going to see a surge of the same extent. Whereas in a lot of these rural communities, especially as you're looking at larger counties in the South and in the West, it's very likely that we'll have recurring workplace recurring outbreaks based on differing workplaces ongoing until a vaccine is available. And then one of the bigger challenges is the implications for healthcare. Within an urban community, obviously, you have larger hospitals, you have more of them, and you have more beds per population. So the rate of access to healthcare is larger in urban communities. And so within these rural communities, not just you have less access to healthcare, but you have this long-term picture where healthcare is going to be strained intermittently over a long period of time. And so there's some implications to how you plan for healthcare capacity, but also it raises some real concerns around burnout, around staffing, as you lose care providers, either because they become sick or they move or whatever the issue. There's a much larger impact, not just for any one particular event, but because you're losing this long-term capacity over time in rural communities. So as we think about infections, managing infections in rural communities is also more difficult, not just the response, but overall the healthcare response that is, but rather thinking about testing and tracing and some of the public health implications. First and foremost, testing and tracing requires more resources for relatively fewer people in rural communities. And this is just because population is less dense. So you have lower economies of scale for testing, means testing is more expensive. You have population centers which are farther apart. You have people which are farther apart, so that requires driving if you're visiting them in person. Just everything takes longer and thus is more expensive. One of our concerns is as we develop models for testing and tracing and staffing capacity and even capacity projections around quarantine and isolation, the implication is those numbers need to be larger for rural communities, even though the population is smaller relative to urban areas. One of the other things within migrant communities is that undocumented workers and just migrant populations that are moving around cause a lot of issues and a lot of challenges, both from a testing perspective, finding consistent test locations, finding people consistently can be really challenging. And as they move around and as we see lead time and testing increase, finding people who test positive so that they can isolate or so that you can trace connections is particularly challenging. And then as we talked about, there's less ability, if you find positive tests, there's less ability for these folks to isolate. Just from a practical economic perspective, people are less likely to be to adhere to quarantine because they have to work, because they have less access to childcare easily, and less access to services which might support them in that. And then, one of the hardest things I think about the shape of the disease in rural communities is these spikes are unpredictable. Because they largely center on group gatherings of people, it only takes one infection to pass along within these environments to hundreds of people, and predicting where and when that one infection is going to happen is basically impossible. And so it requires an ongoing elevated level of response that really can't be dialed down. And that, I think, is probably one of the biggest systemic challenges that rural communities are going to face, of months and months of having to be vigilant and having to keep staff on board and supplies available, because the outbreak, the spike is going to happen at some point. We just don't know when. And last thought, recovery is going to take longer in rural areas. First and foremost, the population, when you look at a sort of a population aggregate, requires longer and more significant care than urban populations. Just again, because it's an older and generally has more comorbidities than you see in urban areas. So that's going to mean longer care needs, longer-term care needs, combined with care costs and more significant long-term impacts. And this is happening in a system in these rural communities that's already inadequate and strained. And so it's going to be a long-term challenge. The other thought is, rural communities are coming at this and facing this challenge already from a disadvantage, from a place where they're more vulnerable and less resilient because of the limited access to services, because individually they tend to be, people in rural communities tend to be poorer, less savings. So any economic impact is going to be felt more significantly, and it's going to take a longer time to recover from. And as we talked about under the economy section, one of the challenges is going to be the economic impacts are likely to be happening over a longer time period in rural communities than they are in urban communities. And then, overall, you combine all this together, it's going to be significantly more impactful for these communities than we would see in urban areas. Because of that, because of the significance of the impact, obviously it takes longer to recover from a community perspective. All right, let me pause there. See if anybody has any questions. Looks like we've got one. So does the difference in the shape of the disease in rural areas mean that we may not be able to advance through different phases? Yeah, so this is a great question. I think largely, what we've seen, and this is one of the challenges of state level reporting and policy, is that what we've seen is typically those state level numbers and then the policy response are driven by urban areas because the urban areas represent such a higher proportion of infection right now. And so it's a little bit of a challenge. We'll talk about this as we get into what the differences in response might be. But certainly, I think what we've seen is that some of the policy responses that are focused on urban communities don't work in rural communities either because they're focused on surge capacity. And so stockpiling PPE in rural communities is just less effective because you'll never hit the high point that you hit in urban communities. And at the same time, the delay that we've seen in rural communities, because it's much more spike focused and outbreak focused rather than community spread, it means that happens over a longer time period. And so where I think some urban communities, especially we've seen this in New York, and we will see this in Phoenix and Houston and Miami as well, as they get over the hump, they're able to return to some normalcy because the significant part of the population that is likely to be infected has already been infected. So they're probably able to get back to normal, quote unquote, more quickly than rural communities would. So it's a great question, and I think that nuance of policy response, especially at the state level, needs to be better, and people really need to think about the unique needs of these rural communities differently than the rural or urban counterparts. All right, so some thoughts, and there's a lot here, and I think before we dive in, one of the key things to recognize is that point that urban communities have felt the impacts a lot sooner than rural communities means we don't really have a lot of great understanding of or examples of successful rural response because they're just at the very beginning of the spiky phase. And so these are some thoughts and some examples that we've seen from our customers, but this is going to be evolving and hopefully getting more effective over the months to come as rural communities gain more experience dealing with these spikes. So first is kind of obvious, as we've been talking about, plan differently, plan for spikes rather than a surge. And there's some kind of specific implications of this. So the downside of the surge in an urban community is the surge very quickly overwhelms testing capacity. So seeing a lot of places, and even nationally, I think the numbers are now up to 10 days turnaround for testing because the demand has so far exceeded the supply and capacity. One of the advantages that rural communities have is they're not likely to get to infections at that scale. Spikes are likely to be in the hundreds and low thousands rather than tens or hundreds of thousands. And so the ability for testing and contact tracing to be effective is much higher in rural communities. And so that would mean that actually focusing on testing and focusing on preemptive testing in workplaces where it's conceivable that you could do that would be a really pragmatic and practical and effective solution, where again, that's not really been the case in urban communities. So the earlier that you can identify those workplace outbreaks, the more you can manage it and the more you can put in place the testing and tracing infrastructure to quarantine and isolate people. So the second thought in planning for spikes, is proactive engagement. You likely know within these rural communities, because the population is so low, in many to most rural communities, there's going to be a few sort of anchor employers which employ a large proportion of a town, or at least a big enough proportion that that would likely be a central place of infection. And so again, because in urban areas, we're looking at 40% or greater of infections are untraceable because they come from community spread. Within rural communities, we don't have that problem. In fact, we can take advantage of that by being more proactive with employers, thinking about enhanced screening, thinking about improving reporting, and a lot of this is just, I think, on the ground, relationship building in these rural communities. Because the earlier that this can be addressed, the more quickly and the more effectively the spike can be contained. And then one of the interesting implications that bears a lot more thinking is, what does this mean for healthcare? And in particular, you have limited healthcare resources in rural communities. One of the obvious things is supply chain planning probably looks a lot different with a lot of low spikes rather than a big surge, in that stockpiling huge amounts of PPE in these rural communities probably isn't necessary and doesn't make a lot of sense. And rather, what they are going to need is a long-term consistent supply that's elevated beyond what they're typically used to. So if you have monthly spikes and monthly outbreaks and surges of 10 or 15 people in the ICU, you're going to need a regular ongoing supply of PPE that's maybe 5 times greater than what you're used to, rather than a one-time increase of 50 times. And so that, I think, bears a lot more thinking. We talked a little bit about the staffing capacity and ability to rotate people in and out. But again, from a healthcare perspective, it's probably in these rural communities a long-term problem and a long-term challenge, much more so than in urban communities. Second thing or category of stuff to think about would be likely, and there's not a ton of great data around this, but I think we'll begin to see this. And from a conservative planning standpoint, one of the things we think it's worth norming people to is rural communities are going to require a higher response cost than urban communities for a couple of different reasons. So first, we would estimate that effective testing and tracing is going to be 2 to 4 times the time and resources required in urban communities, simply because these rural communities are farther apart. Population density is a lot lower, so you don't get the same economies of scale that you get. But even just functionally, travel of contact tracers is going to take a lot longer in a rural community than it is in an urban community. So there's a number of different aspects, but expecting that it's probably going to be more expensive to do the same work in a rural community rather than an urban community seems prudent. Second is, the care requirements we know are more expensive, right? The populations are older, they're more vulnerable, they have more comorbidities. That's going to drive healthcare costs higher. And one of the interesting nuances is when and where people seek hospitalization versus potentially already being in skilled nursing facilities or elder care facilities. Certainly we've seen some of that where hospitalization rates are much lower than expected, even though death rates are about the same. And that's either because people aren't seeking care who should, because they don't have access to it or they don't have an ability to pay, or they're getting that care in elder care facilities or skilled nursing facilities instead of at the hospital. And there's some implications about how to address that and where is the line between an underutilized hospital system and an overutilized hospital system, and something that is likely to be a lot more nuanced in a rural community. And then, as we think positively and expect that a vaccine will be available in the next 6 to 8 months, hopefully, recognizing that administration and herd immunity is going to take longer in rural communities, again, because of those barriers to travel time, access to care facilities, ability to pay. All of those factors are going to mean that it's probably going to be a longer time frame for folks in rural communities getting access to the vaccine and at a population level getting enough immunity within the community that you wouldn't see these spikes anymore. How much longer is an open question, but it's certainly something worth norming to, because again, if you start to see urban areas with a high level of herd immunity and vaccination rates, If you're thinking from a state level policy response, you don't want to assume that everybody is seeing the same thing as the large urban communities. And then the last thought would be this idea of longer time frame. Likely for all the reasons we've talked about, this is going to go a lot longer in rural communities. Higher risk populations mean that care and recovery is going to take longer because they require more care, and it takes longer to recover. It means it's going to obviously last longer, and a larger proportion of the population is going to require that kind of care. And then one of the things that continues to come up is the population in rural areas, again, tends to be less likely to adhere to social distancing and isolation. So one of the big challenges is going to be around contact tracing and quarantine and isolation, and recognizing that adherence to that, especially voluntary, is going to be a lot lower, and that's going to stretch out. It's going to reduce the effectiveness of it. It's potentially going to stretch out the timeline for when we see these spikes go away. Okay, so a couple of wrap-up thoughts here, and then we can take any questions that folks have. So we had a version of this slide last week or a couple of weeks ago. I'm going to keep reiterating this because it's incredibly important. How concerned about the fall am I? And the answer is still very. In particular, as we think about urban and rural communities, talked a lot about urban communities last time. It's pretty terrifying what we would expect to see in the fall. Not really any better in rural communities. And in fact, because of this delay in economic impact, because of the challenges around managing these spikes and the longer time frame it's likely to take, it looks really challenging for rural communities. So, the benefit might be that the overall kind of individual spikes are lower. So there's probably less of an immediate overpressure on healthcare systems, but that's probably offset just by the fact that these are much more vulnerable populations in rural communities. And again, the scary thing long term continues to be the economic picture. And within rural communities, the fact that these trends probably accelerate the negative trends in poverty rate and income and employment that we've already seen over the last 10 or 20 years in rural communities is really scary. And I think the potential impacts of that have yet to be really considered. And then last, safety net services are stretched everywhere, but they're especially stretched in these rural communities where they were probably inadequate to begin with. And service delivery is really challenging when the population is spread out all over the place. And so it's even more likely to be insufficient in rural communities than it is in urban environments. And then, last thought, what do we need to do today? To start norming people, I think that point about state response in rural communities being different in urban communities is a really smart one, and needs to be reiterated to policymakers. And even within a county, if you have a large urban area and the rest of it is rural, recognizing that it can't be a one-size-fits-all approach. The other thing that I think is incredibly important to start norming people to is the cost impact, that we need to be planning for more cost for managing COVID in rural communities than in urban communities. Otherwise, if we try and apply the same cost model, we're going to be delivering less service within rural communities by definition. So I think this is a really important thing for people to consider. There's no good answer for other than spend more money, and that's not an answer most people like. But fundamentally, that's just the realities of providing services in these communities. And the final thought, the short-term impacts that we're seeing today are likely less than the long-term impacts. And so coming back to this idea that, whatever benefit we've seen over the last 4 months from an economic perspective, from a social perspective, those are probably going away. And so that in the data, at least, has hidden a lot of the real effects on people. And we'll start to see those real effects over the coming months. And so the picture is not just likely worse on the ground, but from a data perspective, is likely to get significantly worse. And that raises a lot of questions and a lot of criticism and concern that people will naturally have about how good the data is. And so I think the more that expectation management can be done there, the better. All right, and last, just to wrap up, how can we help? Hopefully this has been helpful content and a good perspective. One of the things that we can do and that we're starting to offer, rural communities tend to be different. We talked a little bit about economic structure, kind of where employment is, whether it's tourism focused or, agriculture or extractive industries. But we can help quantify kind of what the increased cost might be based on characteristics like density or employment characteristics within a rural community. So if more of a detailed analysis would be helpful, that's something we can provide. We have a community impact model that'll be coming out soon here that will bring some projections around unemployment, industry segmented unemployment and poverty rates within communities. And there's some interesting things that shows in rural communities just around significance of impact being so much higher. And then, we're here to help. So if there's anything that we can do around analysis or comms recommendations, we obviously sort of do a lot of this work and have a lot of experience and mostly know a lot of things not to do, but also happy to share that and ideas about ways to improve analysis or communication strategy. Okay, so with that, we'll pause and take any questions that folks have. Type into the chat box or into questions in the sidebar. All right, give everybody a couple more seconds if you've got anything you want to get in there. Okay, well, if you have any questions or feedback or thoughts, again, feel free to email and let us know. You'll get an email at the end of this with a link to the recording, and then we'll send out an email with the slides as well later today. So I want to thank everybody for taking the time. Hopefully this was helpful, and we hope to see you again soon.